Chapter 1. The Atlantis Study. A second look at the near-death experience. Pete Morton, a 53-year-old Air Force veteran, climbed into the military-issue hospital chair the way a cowboy mounts a horse. Pete was a handsome, rugged-looking man with black hair, sun-browned skin, and a deep, raspy voice tinged with a Louisiana bayou drawl. He didn't look like a man in frail health, but he was. Sitting backward in the gray steel chair, he leaned his chest against the vinyl-padded backrest and lit up a cigarette. I still chuckle when I listen to the tape of my interview with him. You can hear him strike the match. I was his cardiologist. The year was 1977. Pete had suffered 2 cardiac arrests several years earlier and was resuscitated each time. Now he was complaining of chest pain. His physician had referred him to the Veterans Administration Hospital in Gainesville, Florida, for a heart catheterization, a procedure during which I would insert a nearly 4-foot-long tube into one of his arteries and gently thread this tube through the artery into his heart. By using a dye injected through this tube, I would be able to clearly see in an X-ray video any heart damage or blockages that might be causing his pain. Before I did the procedure, I needed to talk with Pete about his medical history. At the time, I was already a year into my research on near-death experiences, NDEs, in which I was asking resuscitated patients if they could remember anything unusual about their crisis. When I asked Pete, the room fell silent. The only movement was a spiraling pillar of cigarette smoke rising and dispersing near the ceiling. Pete looked at the doorway behind me, I'm guessing to make sure no one else was around. As he finally began to speak, it was with embarrassing stammers. Clearly, I had caught him off guard. I was asking to hear about something he had told only to his wife, and even to her, only in part. Once she had heard what little he was willing to say, she refused to let him speak of it again in her presence. I assured Pete that he could talk freely with me and that I wouldn't think him crazy. I explained that I was researching the topic. He told me he had left his body during his first cardiac arrest and had watched the resuscitation. When I asked him to tell me what exactly he saw, he described the resuscitation with such detail and accuracy that I could have later used the tape to teach physicians. Pete remembered seeing a doctor's first attempt to restore his heartbeat. He struck me, and I mean he really whacked me. He came back with his fist from way behind his head, and he hit me right in the center of my chest. Pete remembered them inserting a needle into his chest in a procedure that he said looked like one of those Aztec Indian rituals where they take the virgin's heart out. He even remembered thinking that when they shocked him, they gave him too much voltage. Man, my body jumped about 2 feet off the table. Before talking with Pete and scores like him, I didn't believe there was such a thing as a near-death experience. I first heard of the near-death experience as I sat with 20 other people in the Seeker Sunday School class at Trinity United Methodist Church in Gainesville, Florida. Sarah Kritziger, a psychiatric social worker, was giving a report on Raymond Moody's book Life After Life, a collection of stories about people who said they nearly died and who claimed to have seen the spiritual world. Some of these people said they had left their bodies and watched as doctors tried to save them. In our classroom, there was just one physician, me. Somebody asked what I thought. I don't believe it, I said. That was my first public comment on near-death experiences. As a doctor, I had witnessed and performed countless resuscitations, but never ever had a patient told me a story as bizarre as the stories Moody reported, and never had any of my colleagues spun such a yarn. I truly believed Raymond Moody was pulling a fast one. Still, the Seekers class was so intrigued by his book, which seemed to reinforce belief in life after death, that they arranged for Sarah to present a report to all the adults in the church. Sarah asked me to serve as medical consultant for the session and to field any medical questions. I agreed reluctantly. I was convinced the topic was better suited to a barker outside a carnival sideshow. To get ready for the presentation, Sarah and I each agreed to ask some of our patients if they had ever experienced anything like Moody described. I fully expected to collect several negative responses and return to church with my skepticism intact. My mentor, a gray-haired physician who was directing my final months of training in cardiology, assured me I would not be surprised. I believed him. He had an earned reputation as the consummate bedside physician. He knew his patients. He was right. I was not surprised until patient number 3. I walked into Jane Stewart's room at about 8 p.m. on April 27, 1976. She was a 37-year-old housewife who lived in the suburbs of Orlando. Though she had come to the hospital for elective surgery, I saw on her medical history chart that she had almost died several times during her life. Once with encephalitis as a child, once with toxemia during pregnancy, and once during gallbladder surgery. When I asked Jane if she had had any unusual experiences during these brushes with death, the tone of her voice fell reverent. Beneath her words rose powerful emotions. I became quickly aware that she was entrusting to me a story deeply personal. That story unfolded like the pages of Moody's book. I was flabbergasted, but tried to maintain a sense of professionalism as I listened. My colleague, Sarah, also found such a patient. At our church presentation, we each played excerpts of our taped interviews with these people. You can read a book of stories about near-death experiences and walk away as skeptical as you were before you picked it up. But when you look into the eyes of an experiencer and from 4 feet away watch the ebb and flow of authentic tears, your skepticism begins to wash away. I started to believe there might be something to the stories that Moody reported, but all he had was a collection of stories. There was no science in his book. I decided to take the near-death experience to its next logical step. I wanted to see if it would pass scientific muster. It did. After 5 years of research, I published my findings in the book Recollections of Death. Perhaps the most startling discovery I made through my research was that as many people came close to death, their essence, or spirit, actually seemed to leave their body. These people, like Pete Morton, saw details of their resuscitation that they could not otherwise have seen. One patient noticed the physician who failed to wear scuffs over his white patent leather shoes during open-heart surgery. In many cases, I was able to confirm the patient's testimony with medical records and with hospital staff. Skipping religion. One thing I didn't do in my research was to give a second thought to religion. I allowed it no space in my book, no time in my lectures. Why did I delve into the issue of immortality without taking my theology along? Frankly, I didn't see the point of wading into the religious implications of a bunch of stories that were unsubstantiated by even one scientific study. The more embarrassing question is why I left the research scene after my work gave scientific credibility to the near-death experience. The answer is that I felt I had no more to say. I didn't have the spiritual insight at the time to see how much near-death stories could strengthen or undermine a person's religious faith. As a result, I let everyone draw their own conclusions from my work. An attorney from Georgia wrote me, "You left your readers standing before the door of occult knowledge saying, Knock here if you wish." I'm afraid he was right. I had helped put the near-death experience on the scientific map. Recollections of Death was viewed as a landmark in the scientific documentation of near-death experiences. People fascinated with this new subject devoured it as it was translated into 8 languages. But while I was looked to as a leader in the field, I left it to others, experiencers and researchers, to build theories about the spiritual meaning of this new information. What followed was a firestorm of controversy. People who said they had been to the other side began telling exactly what they had seen and learned there. Some of these incredibly detailed stories became best-selling books. Yet most of these books contained revelations that clashed with traditional Christian teaching. Revelations that advocated consulting the dead, that taught reincarnation, and that assured us that absolutely everyone is going to heaven. Many folks believed these stories were eyewitness reports from the afterlife. Other people warned that the Bible says Satan can disguise himself as an angel of light. Journalists argued that these stories were usually unsubstantiated. One best-selling author, for example, refused to provide medical documentation to support her claim that she died. The doctor of another best-selling writer said that some of the medical details crucial to her near-death experience didn't happen. The near absence of hellish stories provoked some Christians to accuse near-death experiencers, as well as researchers, me included, of taking part in a collusion to deny the existence of hell. Some of the more notable researchers fired back, criticizing Christians for accepting only the NDEs that seemed to advance fundamentalist dogma. And Christians retaliated with charges that researchers and experiencers were doing exactly the same thing, but to advance Eastern and New Age philosophies. As I have followed these arguments over the past decade, I have become increasingly disturbed about the direction NDE studies have taken. Of the hundreds of books, magazine articles, and other media reports on NDEs, only a handful contained scientific studies, and not one of these studies used the rigorous methodology of science to explore relationships between Christian beliefs and practices and the near-death experience. In my clinical practice, I began asking my patients who reported having an NDE about how the experience had affected them, both spiritually and medically. What I began to hear in the clinic and at the hospital bedside left me baffled and intrigued. The faith factor. According to media reports, near-death experiencers and researchers agreed that NDEs drew persons away from organized religion and toward a more abstract spirituality. But my observation from my own patients was exactly the opposite. NDEs seemed to produce a stronger faith and a higher level of commitment to traditional religious practice. Since much of the religious controversy surrounding the NDE hinged on this point, I was struck by this apparent contradiction. In addition, I was intrigued with the possibility that this deepened faith and religious commitment in patients following an NDE could be affecting their medical outcome. Scientific studies were suggesting that a patient's depth of religious faith was a strong predictor of survival and healing in clinical situations. This possibility, however, had never been explored in NDE survivors. Other medical studies, including one with seriously ill cardiac patients in a major American hospital, had suggested that prayer was a major factor in survival and recovery. My patients were confiding in me that prayer had played an important role, not only in their NDEs, but also in their healing. The effects of such prayer, both by and for the near-death experiencer, had, again, not been examined. Finally, I continued to wonder just how near to death these people had really come. For more than 2 decades, I had believed that NDEs were near-death experiences, not after-death experiences. As a result, I didn't think NDEs provided insights into life after death. Since the publication of Recollections of Death, however, new medical procedures were allowing doctors to bring people back from what had previously been defined as death. Could these new medical breakthroughs help our understanding of NDEs and death? I decided to study these questions further. This time, I was determined to bring my theology along. One patient in particular convinced me of how little I understood the deep spiritual meaning behind the near-death experience. I met this man one Saturday morning while I was making rounds at the hospital. He was critically ill and in the middle of 40 days and 40 nights of a dramatic medical and spiritual struggle. His name was Darrell Pell.